Johnson & Johnson vaccinations are still on pause here in Georgia as an advisory panel for the CDC reviews some rare reports of people suffering blood clots. The pause is fueling more vaccine hesitancy, though, a major concern in Georgia where our vaccination numbers are still trailing many other states. Caitlin Ross explains how state leaders are trying to address those fears head on.
There were a lot of personal stories today, elected leaders speaking directly to people in the communities where they live, trying to convince them to get any available vaccine.
This time last year, I became the first confirmed case of COVID in Pulaski County. My wife insists that I don't have to be first at everything.
Hawkinsville City Commissioner Shelley Berryhill says everyone in his small town tied teal ribbons around their mailboxes when he was fighting COVID-19.
I was intubated at the Coliseum Hospital in Macon for about 19 days. The doctors were telling my wife and my family that I would not survive the night. Vaccines were only wished for.
But now that vaccines are widely available here in Georgia, he says many people in his community are still wary of them and don't want the government telling them to get a shot.
To balance the valid safety concerns with the livelihood of our communities. And those are tricky waters to navigate.
Commissioner Berryhill partnered with Georgia Health Commissioner Kathleen Toomey today to talk about the importance of vaccines in rural communities where they've had a harder time getting people to sign up for shots. That's even before the state paused the Johnson & Johnson vaccinations.
And there's still a lot of, I think, misinformation and conspiracy theories about where the vaccine came from or what the vaccine will do.
Berryhill is hoping that by telling his story, more people will be persuaded to sign up.
I shouldn't be standing here before you today. The medical professionals had given up on me, but here I stand.
Commissioner Toomey says most people won't be convinced to get a vaccine by having her say it. They're more likely to listen to people in their own communities who they know and trust.